Leary. I am the President and Executive Director of the Coalition for Imaging and Bioengineering Research, and I have the honor of welcoming you all here tonight for our 6th Annual Medical Technology Showcase. Cyber, which is what we call ourselves, our goal is to create and maintain a supportive and educated environment for imaging research. And I'm sure everyone in the room has heard medical imaging has revolutionized the way we treat patients. And you've heard stats about the funding of medical research, but the event here tonight is more than that. We're actually going to attempt to show you what medical imaging is, what it does, and how it directly impacts patients. Fortunately for you, you're not going to hear all of that from me, but you're going to hear it from our members. Our membership consists of patient advocacy groups, academic radiology departments, industry partnerships, and imaging societies. So when we designed this event, we have in mind folks that have no medical background, no science background at all. There's 9 different display areas. If you look around the room, they're all numbered. And each display area focuses on a different imaging technology. But at each display area, there's a patient advocate, an academic researcher, and an industry partner. Further, if you all look at one of the posters behind the displays right now, you'll see a question. And if you just go up to the display and you ask the question that's up there, the onus is on participants at each display to educate you. So you don't have to think. Just get your ice cream and your beer and walk up to one of the display areas and read the question, and the rest will be taken care of for you. It really is that simple. We just want you to learn what this technology is capable of. Another really easy way is this passport that you were given when you came in. Each display is described in this passport, and I had my 6th grader read it and she understood it. So you shouldn't have to Google a single term when you leave here. Further, if you get at least 3 of the pages stamped, so it's a passport, showing that you actually read 3 of the questions on each of the posters, then when you leave, you actually get a swag bag, or more appropriately, what my staff says, it's allowed, it's appropriate, it's cheap, and it meets the Senate guidelines today for what we're allowed to give away for free. I also searched the country for the most amazing academic researchers. There's 14 of them here today, and if you can jump really high and raise your hands if you're here presenting a poster. There you go. They're here today with research posters that will articulate to you what's going on in these amazing academic departments throughout the country. It really is that easy. Just walk up to them, say hello. They do all the talking. Additionally, imaging plays a secondary role. At a lot of these display areas, you're going to see things like a 3D print of a lung. If you needed lung surgery and I had to operate on you, well, not me, an actual doctor, with this, he can look at your lung, find the tumor, which is the wasabi key that's glued to the middle, and actually practice, kind of like taking a few golf swings before it actually counts. You can actually see this and hold it and handle it, and hopefully someone from that display booth will come take this before I drop it. There's a mini MRI scanner here, so you can see how we're able to scan patients, babies with multiple tumors. That's at booth number 9. And if you just open your passport, you'll see all of the other technologies that we're showcasing here tonight. So imaging plays a secondary role as well. Innovative technologies such as neurosurgery. And tonight we have a keynote speaker, Blakely Murphy. She's 17 years old. She is the first person in the world to experience traditional brain surgery with a more innovative brain surgery. So 2 brain tumors, and she's just 17. And what I'm going to do is start with a video that will articulate to you her experience, and then she'll get up and she'll talk in her own words further about what it was like for her. And then after you hear from Blakely, Dr. Steven Seltzer, who is the chair of cyber and the chair of radiology at Brigham and Women's in Boston, will articulate to you a little further how imaging is actually used in this type of procedure and why it is so important. So overall, It's my goal that everyone here tonight leaves with a little bit more knowledge than what you came in with regards to imaging research. And everyone here will sort of paint a picture and a story that you'll remember. Everybody knows the statistics about funding. Everyone knows that medical research is really important. But I bet a lot of you don't know what is available right now and what the possibilities are for tomorrow with continued funding. So hopefully you'll learn all of that tonight. With that said, I think we're ready to start the video from the magic man behind the counter. Thank you.
I never ever like being bad at anything.